Good morning, Abuja. Good morning, Nigeria. Welcome to the 9 o'clock hour of Rapid Done right here on Rapid Television. My name is Martha Alu.
And my name is Victor. Okay, welcome to the big conversation right here on Rapid Television. Welcome.
Yes, we hope that you've had a good morning so far. For the big conversation today, we're talking about something that every single one of us was a part of while we were growing. And this week, the world joins hands to mark the World Breastfeeding Week, an annual campaign observed from the 1st to the 7th of August to raise awareness about life-saving benefits of breastfeeding and the need to create supportive environments for mothers and babies. Breastfeeding is one of nature's most powerful gifts, and according to the World Health Organization, it provides infants with all the nutrients they need for the first 6 months of life. It strengthens their immune system, reduces the risk of infections, and supports healthy growth and brain development. For mothers, breastfeeding has also been linked to a lower risk of breast and ovarian cancers, type 2 diabetes, and improved recovery after childbirth. Yet, despite all these established benefits that we've listed, many mothers still face very significant barriers, from cultural myths and societal pressures to inadequate maternity support, workplace challenges, misinformation, disinformation too, and limited access to professional guidance. Now, exclusive breastfeeding remains a very difficult journey for many families. So this morning, we're asking the very important questions. What does successful breastfeeding really look like? And are there women who genuinely cannot breastfeed? What should mothers know about expressing and storing breast milk? And how do we separate medical facts from long-held myths? And joining us today for this conversation is two very beautiful women, which I believe are authorities in this field. First, we have Eukarya Eke. She is the Chief Nutrition Officer for the Ministry of Health. And then we have Chidimma Akparanta. She is the Assistant Chief Scientific Officer for the Ministry of Health. Good morning, and thanks for joining us on the show.
Good morning.
Good morning.
Good morning.
Good morning.
Welcome.
You look fantastic. How has this been? Because it's a week-long event, and I know that it's a lot. You guys are just all over the place,
Right.
TV to radio, doing your, sensitization program. So just walk us through how this has been from the 1st of August.
Truly, it's a nice one. I know World Breastfeeding Week is an annual event,
Okay.
which we normally celebrate from the 1st to 7th. There's a very long week event, and it started in Italy during the Innocent Declaration, which was organized by WHO and UNICEF. And on the course, they made that declaration that each country should do what? Should promote, should protect and support breastfeeding, because they know the essence and they know the importance and the benefits. So that is what we are doing now. Starting from the onset, we have done a lot of activities. Today is marked the 6th day of the celebration. We have done a lot in terms of flagging up the ceremony. Apart from that, we did a workshop where we go to different designated markets like Wuse Market and Otako Market. And even we have done community sensitization using the barrack, one of the barracks, Sinifan Barrack, where we did a lot of awareness creation and every other thing. And today we are here, and a lot has been ongoing, broadcasting, creating awareness. That's the essence of World Breastfeeding Week. And for us to have what we have done, the progress we have made so far, for us to know the orders, the strategies we need to put in place. Because for today, according to the National Demographic Health Survey 2024, the exclusive breastfeeding is still 29 as at 29. That is also, yes, 29%. That is another thing we are worried about, because you're supposed to go beyond that. So let me just pause now.
But since you cited that survey, basically stating that, of course, still below 29%, Why is that so? What are the challenges that you've seen, you've spotted out in the course of all of this awareness? Basically, I'll come to you. Okay, anyway, if you can.
Okay, go ahead.
Okay. Anyway, with the interventions we have done so far and the strategies we have already mapped out, we find out that our most important this thing, where the worry we have is putting water, plain water. Addition of plain water into breast milk is a very big challenge. Because according to the same survey, about 43% of women are still adding water.
In breast milk?
In breast milk.
Why? Just
using water. They say that breast milk is not is not enough.
Wow.
Especially those of during the hot weather. They say that it's not enough. But we keep on telling them breast milk contains almost 87% of water, which you cannot even scientifically prove and research proved. But they are still worried, especially during the hot weather, they have to add. This is our weakest challenge. This is the biggest challenge we have. If they can remove that water, that plain water, we will go closer. We will go in the exclusive receiving breastfeeding rate will increase. But because of this water, is still drawing us back. And other myths and conceptions.
So if I may add, Nigerians breastfeed.
Okay.
Yes, a lot of mothers, when they give birth, they breastfeed.
Okay.
But the problem is that they don't exclusively breastfeed for that 6 months that is recommended. And like she said, this is part of the myths that we're trying to dispel, that they need to add water, that the baby is not getting enough from taking just breast milk. But we're trying to say it has been scientifically proven that the breast milk contains all the antibodies, all the nutrients that a child needs for that first 6 months of their life.
Yeah.
And every time they add something else, they have reduced the effect of exclusive breastfeeding. So we want to promote it and keep saying it, and especially for the young mothers, our Gen Z mothers. Most of them have the challenge that they don't want to, their breast to fall and all those kind of things. You understand? And they have access to breast milk substitutes.
Yeah.
And because these are readily available and on the shelves and everything, and they take advantage of, augmenting breastfeeding with that. But we're saying, no. Let the child get the best start in life. Let them enjoy it because it helps them. It helps their cognitive development. It helps to fight infections. The benefits are so much. So that's why we are promoting it exclusively.
Okay, let's take from what you have said, because I see that your theme for this year is breastfeeding for a sustainable start in life and strengthening what works. So talk to us about the theme for this year. Why this theme and what is different? Anybody can start.
Okay, it's sustainable. When we say that something is sustainable, which means that particular thing can come at anywhere, can go anywhere. You understand? The sustainability means no matter the condition, you must thrive.
Okay.
Whether in emergency situation, we talk of breastfeeding, and that is the only thing that can, during emergency, we have shortage of water. We have this. Some of them are in the IDP camp. Yeah. Some of our women, they are running head and skater. But breastfeeding is the follow come. It's natural food falling from heaven. So we don't need any person or any addition or any this thing. So you carry it along with your child and breastfeed the child. Even it's cost free. There is no financial implication in breastfeeding. You understand? So even inequality is a natural equity that make every child is accessible to every child, whether it's a from poor family or from medium family or from rich family.
Yeah.
Every child has the equal right to breastfeed. So that is why it's sustainable.
Okay.
And we say we need to strengthen. We need to strengthen it because of its sustainability. You understand? So we have various ways of strengthening breastfeeding.
Okay.
Like we have our employees, some of our mothers that are in government places, in offices, that are working. Many of them thought that there is no policy backing it.
Okay.
Like in the Federal Ministry of Health, we have a pronounced policy.
Okay.
Like our public service rules stated that every woman is entitled 112 working days
After childbirth?
Yes.
after childbirth. Yes.
She's almost 6 months.
Even our fathers,
Fathers,
the
yeah.
husbands, have 14 working days, at least to take care of the wives.
To help with the chores in the house.
Help, exactly.
Yeah.
At least before the woman, during the recuperation
Period.
stage, yes. And even that particular public service rule also have provision for single mothers. I mean, even single fathers.
Okay.
84 working days. So it's enough.
So do Nigerians know?
Yeah, they know. The only thing is that, you know, our Nigerian factor, we are not good at reading. It's there. Public service rule revised is there. So this is one of the policies that guides everybody. Even in the marketplace, we usually encourage those traders union to have a centralized crèche.
Yeah.
If you say maybe I'm not working, I cannot exclusively breastfeed, you have centralized crèches where they can just put their children and go to their market and subsequently come and breastfeed. Apart from, okay.
Go ahead. No, finish that thought.
So these are the policies. And again, and it's paid maternity leave. Not that you are just going
Okay.
without receiving
As
the
it's
pay.
paid for.
You understand? And again, some of these are government places. We have, like in Federal Ministry of Health and other, we have a centralized crèches that women, those ones in the around the secretariat can visited there. You understand? They can put their children there and have what we call the flexible working hours. At intervals, go and breastfeed or express.
Okay.
So these are some of the provisions that can strengthen. And again, the employers also should understand the need without having sentiments. We also talk to them. Let them encourage these mothers to go and breastfeed.
Expressing does not reduce the quality. I just needed to ask that quickly. Because some people have the opinion that if you express, it's not as the same thing as when you actually breastfeed the child. Does that change the quality of the breast milk at all?
It doesn't.
Okay.
It doesn't. As far as it is stored in the right temperature, which is the room temperature. And it can stay there at least 4 hours without being sold. You understand? Getting sour.
Okay. 4 hours.
Yes, it can at least, I say at least, it can exceed depending on the temperature. But at room temperature, it can stay for at least 4 hours without anything. So what we normally advise them, you can just put it in a cup that has a cover, put it in a water. You know, that water will drive flies away.
Okay.
Because, you know, flies, they like sweet things.
The water is not in the breast milk.
Yes, you know, the cup,
inside.
yes, we dip inside the room, that's ordinary water, put it there. You understand? So that is what we normally advise them. It doesn't change any quality at all.
You have a
So
thought
yes,
there.
I have a thought. So we also want to encourage mothers, instead of using the feeding bottles to give those milks that have been expressed, they can use a cup and a spoon. It's more hygienious. It helps to prevent infections because those bottles, if they're not, they have slim corners that you sometimes might not be able to wash thoroughly clean, and then bacteria and everything will get in there. So if they use spoon and a cup, it's easy. And then it, you know, like they said, sucking strengthens the child's muscles. But when you start giving them bottles, they become lazy and tired because they have seen an easy way out. But once you're able to use the spoon and the cup to feed them, you understand, they take it better.
Okay. There. Let's talk about postpartum depression and anxiety that most women actually experience after giving birth. You know, how does this affect breastfeeding as well?
For that area, we like to say that that's where the support comes in. The support of governments, the support of health workers, the support of communities, the support of families. Women go through a lot after childbirth. So they need as much support as they can get. That's why we are clamoring for that 6 months, so that within that time frame, the woman will be able to get herself together. And then she needs enough counseling from health workers. You know, when you're going through postpartum depression, You need someone to talk to. Don't keep it to yourself. Even the husband should be understanding and know that the wife is going through something.
Right.
So she needs to speak. She needs to, at that time, it's not the time where you say, you come back later and you say, where is my food? Or, what did you cook for me and all that?
Yeah.
You understand? You should be able to help even when the baby is crying, because during that period, the woman doesn't even want to hear the baby's voice crying. So you should be able to hold the child for her, speak to her, spoil her silly. Because she has gone through a lot. And you understand? That's what the week is about. It's about the mothers that are breastfeeding and breastfeeding exclusively. They are paying the price.
Right.
It is not their sole responsibility. That's why everybody must come. When you see a breastfeeding mother, a nursing mother on the road, you should maybe holding her back to cross the road. If you go to some countries, you see that there are things they put in place, systems they put in place to support these women. When you enter a bus, you see that they have kept the front rows for the woman. The woman enters into, she feels that love within the community that, okay, we understand what you're going through. You are betting a nation. You are bringing people who are going to be the workforce of tomorrow, who are going to be geniuses. So when she gets that support, it eases that condition, the anxiety, the depression that she's going through.
Okay.
Yes.
In addition, what she has said, summarizedly, we understand that breastfeeding is an act and it's a collective responsibility.
Yeah.
It's not a woman's show alone. That is what this awareness creation and sensitization is all about. Let them understand. We are talking about a woman that has gone through health. Through labor processes, pushing out is a long route. So this woman needs to be encouraged. This woman needs to be supported in different ways. From the husband's aspect, provision of what the woman will eat, adequate nutrients, helping in the domestic chores, because this is the woman. Breastfeeding, we are saying breastfeed exclusively. Is demanding. Is demanding and needs time. So for you to encourage this woman, the husband in the house must also help. Some of the works that the woman used to do, it will just take over. At least taking care of the elderly ones, children in the house. At least the woman's eye will just move out from that one, concentrate in breastfeeding. And apart from that, the families generally we also have their own contribution. The mother-in-laws, you have to bet the woman. You have to help in betting the child. You have to bet, different, like in different cultures, they praise the woman, help her to taking bet, prepare pepper soup, all these things. You understand? For the woman to recuperate, it's not easy. And again, society at large as well. In different ways, society is helping, like creating awareness. Let people know the importance of breastfeeding. Traditional rulers, even in churches, they're supposed to tell their members, these are the influencers. They're the one that will talk to the people, traditional leaders, the religious leaders in the churches, at mosque. They will hear a lot, more than me and you speaking.
Right.
Yeah.
Because even there was a time we had a pamphlet like that the key messages churches can give to their own audience, the key messages is here. We have them in place. So talk to them. Even in our government sector, we have policies. I think I've already mentioned it. We have a lot of policies. We have a lot of strategies. We have a lot of guidance, support and programs and intervention strategies supporting this breastfeeding we are talking
We'll
about.
revisit the policies you were talking about, but before we get to the awareness, there is some parts of women that we're not paying attention to, and these are the ones that actually want to breastfeed but are not producing milk. So what do you think is responsible for that? Some women have given birth, they're supposed to lactate, but they are not. And the breastfeeding week says the child needs to grow well. So does that mean their own children will not grow well? What can they do, and what is the cause of this condition?
Okay, so if I may say, for mothers that are not lactating at this time, it's a problem because we encourage women that once you are pregnant, you understand, your nutrition is important. What you put into your mouth helps the body to function properly when the child is in there. And then another thing there is that the counseling of the health workers, that is the important, that they say, go for antenatal care, and you get the right information on what to do, because without those information, then you have a step back. And you know, one of the things that the Ministry of Health is promoting is early initiation. 1 hour before, as in 1 hour after childbirth, that baby must be put to breast milk. Once that is avoided or missed, you know, it becomes a problem. So, you know, yes, the woman has come out from labor or a cesarean session, she's tired, she's still trying to get herself. It is not her that it falls on to put that child. It's the health worker. So it depends on the kind of facility she goes to and the information she has at her disposal. So once she gives birth, that baby is supposed, because it's, you know, when we talk about the human body, nature has already designed it. Once you put that baby there on the breast, your body begins to send signals to your brain that, oh, the person who we have been preparing this food for is here now already.
It's around.
It's around. So he has to put his mouth there immediately, because once he does not put his mouth there, that means the body say, okay, maybe we are wrong. So those are the things that causes this poor lactation that we're talking about. So women have to have that understanding. Even once you're almost due, you know there are things that the health workers can help to do and help you with during your pregnancy journey. You need enough information. Yes, so that's why we say keep on with it.
This is the awareness. Okay, just do that.
Okay, in addition to what she has said, every woman has breast and desire to breastfeed immediately after birth. But sometimes it doesn't follow suit. As she has rightly said and stated, you see, that nutrition is a key. Apart from that, going to antenatal early enough. You know, some of our women, especially those in rural areas, some of them that deliver in the house, they don't care. You understand? But we encourage them to go to facility. At least we have the primary health care. At least where they can get nutrition advice, get health talk, get counseling from these health workers. You understand? So, you know, during the counseling, they know health workers, the nurses, I know they normally they emphasize that there should be no nipple. Starting from that time they are pregnant, they're supposed to be cleaning the nipple. If you look at our nipple, it has dents. You understand? It has blocks. So they need to be cleaning it, especially when they are taking their birth. So that during that, after delivery, everything, you know, when they keep on doing that, some people before delivering, the milk has started coming out. Yes, you understand? This is another strategy that we normally, they can use to make sure that they have breast flow. And again, as she said also, early initiation is a key. Within 1 hour birth. That early initiation, immediately the woman, you know, before it was 30 minutes, but that now is within 1 hour of birth. Because so before the midwife might have cleaning, do this, that 30 minutes. They say they cannot initiate. But that's why they extended it to within 1 hour. You understand? That within that hour, that child must support the woman to initiate breastfeeding. And nature made it. Immediately you just put the child on that woman's breast. That child will be rooting, looking for where the breast is. Oh, before you know it, they just grab it. And we encourage the woman, whether it's flowing or not, persist. There's some women who say, hey, my child is not, my breast. No, that anxiety can even escalate every other. You understand? So we tell the woman to relax. It will come because it's a hormonal issue. And as far as the child is sucking the breast, suckling, before you know it, it will open up and the child will start taking the breast milk.
Okay. So every August, that's why you get to celebrate the World Breastfeeding Week. Now, what are some of the measurable impact that the Minister of Health has actually achieved over the past years? And how do you also get to measure your success beyond the media visibility? Talk to us.
Want to go? Okay, so we actually have the BFHI. We established breastfeeding friendly hospital initiative. That's what it's called. Having breastfeeding friendly hospitals where, you know, they have corners and they have messages, you know, that the women, when they come there, they are able to see and they are able to know what the advantages of this breastfeeding is.
Okay.
Yes. And then we also health worker trainings. We always have health worker facility trainings to, you know, always brush up the health worker with the new global information that they need to help them counsel these women during their journey.
Okay.
Yes.
And again, there was a time, was it past years ago, that the ministry developed a zero water campaign. We did zero water campaign to tell the women, to tell the populace that you don't need to add water. That is the strategy we use. It's a campaign all over. But what I'm just saying is that we need more awareness creation on this campaign.
Yeah.
Okay.
Telling them, without water, this child can thrive, because our breast milk is very, very rich in all these nutrients.
And then
And they contain antibiotics as well.
We also facilitated the 6 months paid maternity leave and the paternity leave, because we already understand that the woman needs time to heal, because once she's able to heal, she can be able to concentrate and function properly when she gets back to work. Because if you have a baby at home and she's thinking her baby's crying and all that, you know, she will not give her best. You find out that some people, when they are about to give birth, they say, no, I will stop this work. After my breastfeeding journey and my child, that 6 months, then they'll look for another job to start. So you keep
life on hold.
Yes, they put their life on hold. So these are the things that have been put in place to encourage mothers that we support you in your breastfeeding journey.
And all these are registered in our public service rules. As earlier stated.
Ms. Victoria, before we go on this break, you said something about early initiation. And I'm looking at the data from 2018. It has dropped from about 42% to now 36%. And Lagos State has doubled the national average. So what is happening in Lagos State that is not happening in every other part of the world? And why do you think that there's still a problem with early initiation? Is it the health workers? Is it the mothers? What exactly is the problem?
Okay, well, as you rightly said, you know, early initiation, as we have now, has dropped, as you said, 35.5%, according to National Demographic Survey 2024. The national, I want you to draw your attention that the national data, what do we call it? National data. It's not state data.
Okay.
You understand?
Yeah.
In national data, we are talking about 774 LGAs.
Yeah.
We are talking about 36 states plus FCT. You understand?
Yeah.
So, you know, when you are doing something collectively, there are some regions
That will do better.
that will do better than the other one. It's just like we are talking about malnutrition.
Yeah.
I know with the economic situation of the country, malnutrition is almost everywhere. But there are some regions that has higher burden, like our brothers in the north, those 19 states.
Yeah.
They have more burden of malnutrition. So when we are doing collectively national data, we are putting everything together. So those ones with higher burden, we, you know, pull out those ones that are doing better. And again, you know, Lagos as well is a cosmopolitan city. And you have diverse. I know that there are some people that own Lagos State, but you have different tribes
Yeah.
all around. So many of them are allies. Many of them have the way to do things, to get things done. You know, and they have supporters.
So you think education is the
Yes, it's also is a plus to them as well. And again, because you have many tribes, it's not that culture that can influence them will not be will not be there like that. You understand? And look at when you are comparing it to maybe all this maybe Imo, this is not like that. So that is why you have many of these their percentage
higher.
that is higher like that compared to other places, and they have partners supporting. You see, all these things also encourage.
Right.
The national data is national data. It's just a blanket covering every state. So some of these states can pull down the value.
Yes.
So that is what we are seeing.
Right.
So we are not discouraged, no matter.
All right, thank you very much. If you're just joining us, we have been having a conversation centered around breastfeeding in commemoration of the Global Breastfeeding Week. And we have had representatives from the Ministry of Health join us on this conversation. We'll go out on a very quick break now. And when we get back, we'll keep up with the conversation. Please stay with us. Welcome back and thanks for staying with us. It's still Rapid Dawn right here on Rapid Television, and we have been having conversations about the World Breastfeeding Week. And we have with us in the studio Ms. Eucharia Ake. She's the Chief Nutrition Officer for the Ministry of Health, and we have Ms. Chidinma Akparanta. She is the Assistant Chief Scientific Officer for the Ministry of Health. Thank you so much for joining us. It's been an enlightening conversation.
Thank you.
All right. Let's talk a bit now about policies. And you, Mrs. Eucharia, have mentioned many times, we have these policies, it's in the book, you know, for public servants, if you are lactating or if you just put to bed, you know, all of these policies. What about the people from the private sector? Because your conversation sounds as though everything covers for people that work in the public sector. How does this also affect the women in the private sector? Because more women are starting to build businesses and working in private sectors now.
Okay, thank you, because this question has been my concern each time.
Okay.
Even anytime we're organizing for this World Breastfeeding Week, you know, especially schools. You see, government cannot carry everything at the same time. We are trying to make sure we standardize the public sector, holding it firmly. And you know, some of these private sectors, some of them are accredited. They have done the accreditation and registered. So we are using strategy to bring them to our close so that they will do what? They will know what we are talking about. Actually, this global campaign is for everybody, whether private or public. We used to tell them anytime we have community sensitization, we have town hall meetings, because within these days of activities, we visit these places to do general campaign. And we normally like those people, the influencers in the community, to hear us. The key stakeholders in the community to hear us. You understand? So we do all this campaign for them to key in. You know, as you said, it's private. They are using their money to do whatever they want to. But I know that whether private government owes them, but it's a strategic action we are trying to use to make sure we draw them. You understand? So we talk to them as well. And some of them, I know some schools that have crèches. Standard crèches, private schools, because they know the importance. You know, we cannot carry everybody along at the same place. You just piece by piece, especially these private sectors. You understand? But I know some schools that have crèches, even in primary, secondary. You understand? They have crèches where those workers can bring their children. And again, what I normally say is that if I know government is working towards that. Maybe any, for instance, school or any establishment, it should be one of the criteria. If you're establishing this, you must put this in place. Because we know that things are good, very, very good now. One hand cannot do it alone. Many of our women are into labor force. So they need to be encouraged and they need to be supported. So how do you support them? For instance, there are some schools that will tell you, until you serve me for private schools, until you serve me for 2 years, you will not have any child. You know, it's madness. You understand? To me, it's madness. When I was looking for a job, they did something like that. I just carry my file away and walk away. You understand? I just married, and you know, in our culture, when you marry, just with at least you are pregnant, and you are telling me that I will serve you. One school in Lagos, I have to carry my file and left. There's one before I joined ministry, I was in and that is the action I want many of our workers working in private sectors to be doing. So the woman called me that please, because I'm an educationist as well, that I should come and help her because my children are in that school.
Okay.
I should come and help her. And he knew that I've been teaching. So I said, I will not teach again. Let me just establish my business. So as I came, because I was one of those PTA members. Okay. So she knew my capability, that what I contribution, because some things I would say during the PTA, if you just do it, it will work out. So the woman just cornered me that mistake. I learned that you have resigned. Where you're going to, please come and help me in my school. I said, I have a 6-month-old baby. So do you have a crèche? She said, no. I said, I can't come. He said, Mrs. Eke, I said, I can't come because I need, this child is so precious to me and I'm doing exclusive breastfeeding. You understand? So I have to continue. Now, after 6 months, you have to continue.
So
for 2 years and even beyond.
From informed decisions.
Yes.
Yeah,
so as I said no, the woman called me back and said, please, just give me 2 weeks because they are the owner of the place. I will establish something. And behold, before that 2 weeks, the woman called me. I have established crèche. I said, wow, I'm coming. That was why they normally call Madam my child chairman, because he's the one that they use to do the campaign, do the everything for that crèche. That is how it started. And other people are enjoying it today. And if you see that crèche, it's as big as, very, very well standard and everything. You understand? And the woman is also using it for her own income. Generating income from there. If we can hold our heart like this and be saying something like that, it will move them. And I know similar schools that time emulated her.
All right. So if I may add, there are also plans also sent to the National Assembly also for policies and laws to be put in place to also have private establishments and private sectors to also put the 6 months paid maternity leave in place, just as the government is already, because government is leading and showing by example. But sometimes you have to have laws, because even the one that government has, there are laws that backs it up. So there's also plans. You have some advocacies to the National Assembly, and you have some civil society like CSON. They keep speaking on this to get the National Assembly to put in, laws to help, get the private sector to work with this for them. And so our own duty is to speak to them, to understand it. Once they understand it, then it will be easy to put in place. And also the government has the Federal Ministry of Labor and Employment, who oversees most of the private sectors. They have inspections. So within that, there are inspections. They also speak to them about having breastfeeding work-friendly places within their systems that could also help these women. That even if they come back to work within 3 months, they have that comfort that gives them the opportunity to also exclusively breastfeed and have flexible working hours. So this is a conversation. And this is why we're doing this campaign for more support, because we need it.
And in addition, there is one survey we did, 2019. In that survey, we did it in 6 days. Especially we also interviewed them, the public sectors, the private sectors. That was when this issue of a 6 months maternity leave was coming out newly. Many of them, it doesn't want to hear it. It's only public sector that you understand. They say, government is not supporting us. How can we leave our work? So 6 months, half a year. And some of them, when they are coming back, they will come with pregnancy. So they will come, you understand? So these are the issues. But what government is just telling them around that time, during the findings, after the findings of what we have on ground, just establish your crèche. At least 3 months is more than enough. If you have crèche and you are coming to work, you drop your child there, you have flexible working hours, you can go and breastfeed your child or express breast milk. You go back. Everything is normalized. You understand? The only thing is that we don't know, it's just for you to, that continuity of breastfeeding, not having that gap. That is what we are fighting for. So if your child is beside you, is very close to you in your place of work, you can quietly go and do that. Within 30 minutes, you are back and come to your work.
So after the campaign, after the awareness in the month of August, right? What other things do you do to ensure that this information keeps going out there to the people, to keep them more informed?
Okay, that's why we're in the media, because the media is our partner.
That is it.
Yes. So yes, the media is our partner. So we expect that as we share this information, the media will also help us in disseminating the right information. Because sometimes, like you said, some people have the very wrong information. Like when they talk about the myths and all that. So when they have the right information out there, that's the power of social media and even the media. You know, like people listen a lot to this, like especially Rapid TV, you understand? So if we can have the media speaking about it regularly. And we will still continue our work. We don't stop here. Yes, we have, we usually have MySIN trainings. We have Iman trainings. And this is because we keep training the health worker. Please, these people need the right information. So it's not like only once we get to the campaign, then we stop. No, it's year long.
Rapid is open to continuous partnership because I mean it's not just August consistently being up there. But just talk to us quickly about your 1,000 Days of Life campaign.
Okay.
Anybody?
Yes. Thank you very much. This 1,000 Days of Life, I've earlier explained, starts from pregnancy. When the woman at least has that day said, I have assigned that you are pregnant. From that day till when the child is 2 years, that's the range. Why do we choose that range? Not that other extension is not necessary. All of them are key. But this particular range, 1,000, that from 9 months till 2 years is where the child need adequate nutrition, because that is where growth, development, brain formation, you understand, cells division, everything normally take place. If we can get it right from there and extend beyond, will not be a problem, because it will be a continuity. We don't want to take a long under 5 the whole. You understand? This particular range is very, very critical. Anywhere we miss it is a very big problem to that particular child. Right from that pregnancy, that is where cell division comes. That is where brain development comes. That is where other parts of the body, growth, development, everything. So the mother needs adequate nutrition. Adequate nutrition.
So that's why it's a social behavioral change campaign. Because so it's not just for the mother, it's for the environment. So now we're going to have billboards, posters, everywhere, so people can see it. Whenever they see it, they remember, this is the time to support. This is a general call for everybody to support the breastfeeding and also to support the 1,000 Days of Life nutrition during this period.
All right. Thank you so much. It's been a very interactive morning here in the studio, and we have been having a conversation in commemoration of the World Breastfeeding Week, and we have two how will I call them? Two specialists here with us who have been giving us, their thoughts on the matter. So thank you so much, Mrs. Eukaria AK, and thank you so much, Mrs. Chidinma Apparenta, for joining us. Thank you. All right, people. Victor, what are you? I hope you were taking notes, because they gave points. Very good.
But very importantly, everyone has to support, especially men out there. Once your wife gives birth, stay home. All right.
Don't stay home. Stay home for the period of time.
Paternity leave is there.
Paternity leave is
14 working days.
We have to support as much as possible. So it's not just for the women alone. There's that misconception that breastfeeding is just for the woman. Now we know, that it's not just the sole responsibility of the woman. The husband have a role to play. Family members have roles to play. Even neighbors have roles to play. So
mother-in-law. Mother-in-law is very important. Very important. The mother-in-laws of this day, they will say, no, I'm going for Mugo, but my own is to go and sit down and carry baby. The woman should do her own. So we are begging the mother-in-laws, please support your daughter-in-law.
All right. All right, people. And then finally, I guess said something about social and behavioral change. These myths and misconceptions, what needs to go, and you need to adopt new mentalities regarding childbirth and breastfeeding. Thank you so much for being a part of our programs this morning. Just to remind you, we're active across social media platforms on Facebook, on Instagram, on X, and on TikTok. It is at Rapid TV. On YouTube, it is at Official Rapid TV. Give a mother, a pregnant woman who needs to know about these things. And then www.rbnradiotv.com allows you to connect with us from anywhere in the world. We are now on free TV. You can download on your iOS and your Android phone and look for Rapid TV and connect with all of our programs anywhere in the world. Thank you so much. My name is Martha Alum.
And my name is Victor. Okay, we'll see you tomorrow.